In this presentation, I will be discussing the opioid epidemic, including how it evolved, how it is affecting the entire country, along with potential solutions that could help to resolve or reduce the current opioid crisis. As the image on this slide represents, the opioid epidemic is across all states of the U.S. and is a tremendous issue for everyone. Before the opioid epidemic ever came to be, prescription opioids were rarely prescribed for any form of treatment besides treating those with cancer or chemotherapy. At some point, physicians in the World Health Organization began advocating for the use of prescription opioids for additional uses and treatments which drastically increased opioid use. In addition, a movement came about in which physicians began treating pain as a fifth vital sign, so in addition to checking temperature, pulse rate, respiration rate, and blood pressure, patients were now being evaluated for their pain levels when they were seen by any physician. Consequently, this led to an increase in prescription opioids, contributing to the current state of the opioid epidemic. In 1995, Purdue Pharma began advertising and promoting the selling of the drug seen here, OxyContin. This drug was falsely advertised and many people did not know or understand the risk of addiction upon consumption of this drug. Additionally, the pharmaceutical company interacted with physicians and increased their likelihood of prescribing OxyContin. Ultimately, the promotion and prescribing of OxyContin is what sparked the opioid crisis we are currently living in. On this slide, we have data concerning the rise in opioid-related overdoses or deaths following the release of OxyContin. In the image on the left, we see that when OxyContin is introduced, there is a rise in opioid overdoses, especially in the non-triplicate states. Interestingly, the triplicate states, or the states that required physicians to go through extra paperwork to prescribe OxyContin, had lower incidence of OxyContin-related overdoses. However, the number of overdose-related deaths following OxyContin introduction still increased. The image on the right also indicates the rise of prescription opioid overdose as starting in 1999, just a few years after the introduction of OxyContin into the drug market, in which the number of deaths increased by approximately twofold. What exactly do people abuse prescription opioids for? Well, the most common reason is the reason that these medications are prescribed for in the first place, that is pain. The issue is that the people abusing or misusing prescription opioids did not obtain them legally or by their own prescription. Instead, they got them from elsewhere and are using them to treat their own pain. The issue with this is that because these prescription opioids are so addictive, it causes those who initially obtain them and misuse them to become addicted and then continually crave these opioids, furthering the opioid epidemic. With the rise of the opioid epidemic, we also see the difference in amount of prescription opioids that are prescribed per state. These images depict the states with the highest rates and those that overprescribe prescription opioids, including Kentucky and Oklahoma, and those with the lowest rates of prescribing prescription opioids, including New York and California. As stated in the previous slide, the overprescribing of prescription opioids is common and especially in certain states. With the overprescribing of opioids, we see more abuse and misuse of these drugs. According to numerous studies and data, a majority of the misused prescription opioids are obtained by family or friends for no cost. To solve the opioid epidemic, it is important to practice prevention. Prevention can happen by educating youth and college students about opioids, how addicting they are, and the dangers of prescription opioids. Additionally, it is also important to better educate both physicians and potential candidates for opioids on the risk factors that may increase one's likelihood of becoming addicted and having a hard time stopping the use of prescription opioids. Physicians should be better educated and more aware of the alternative forms of treatment for pain. Studies have shown that acupuncture, flavonoids such as quercetin, and cognitive behavioral therapy specifically for insomnia can help reduce or resolve pain. Prevention is important in ending the opioid crisis, whether it be through education or stricter prescribing policies. Also, establishing better treatment plans by enhancing physicians' education is also an important factor in resolving the opioid crisis.